What is structural racism and how does it contribute to health disparities?
When we talk about structural racism, Dr. Rodriguez and Dr. Abdullahi talking about those social determinants of health, there's definitely a tie-in there. And so there was a very good article recently written in the New England Journal in the December edition, um, talking about the fact that there's no sort of standardized definition, but what we really need to recognize when we talk about structural racism is that it's beyond just sort of individual prejudice. It's more about how racism is embedded into our structures, meaning our laws, our policies, even our economic system, and our cultural norms. And looking at, how do we dismantle that so that we can ensure that, we achieve, ec- equity. And so we'll go into more examples, but it's really looking at the policies and the rules and the practices and how that all plays into structural racism and perpetuates these health inequities, and looking at how to dismantle that.
Thanks for that, Dr. Wright. And I think one of the examples that we could bring up to really hone in on what is structural racism, because like you mentioned, it's difficult concept to wrap our heads around. And so when I'm explaining it, usually I like to bring up the concept of residential segregation and really how that stemmed from redlining that actually was in the 1930s. And so redlining, for those of us who don't know, just a quick history lesson, it was at the time of the 1930s, these redline maps were actually created out of a federal policy to actually show risk areas for new government homeowners programs. And so basically what the HOLC ended up doing was creating these maps to basically categorize which areas that were more risky to for homeowners. And they denoted it by different colors. And so red was the most risky area, and it was red because it had the most amount of foreign people. It also had the highest amount of Black people as well. And basically the green area was the best, and so the other colors in between basically, were pretty much areas of risk in between the red and the green. And so what ended up happening was that the creation of these red line maps ended up leading to accumulation of wealth and outside of the red line areas, and also really affected the way we have funding and zoning of highway locations, school locations, and also the location of where we put our toxic hazardous dump sites. And so, over time, the policies that led up to redlining and it was essentially removed. We no longer do redlining. However, those structures that were created by the redlining maps are still in place. So unfortunately, we're seeing that. I want to think, just for the audience to think about, who is in your neighborhood. Think about the kids that go to your kids' school. Think about the racial makeup of your community. Really, this is all what we're seeing as a reflection of what happened in the past. And I think another great article that brings up some relevance for our asthma and allergy patients was actually in the Lancet actually last year. They actually looked at some redlining maps in several cities in California, and they tied that to asthma emergency room visits and saw that the same way those redline maps were created, it correlated, exactly with those asthma ED rates. And so the areas that were actually in the red back in the 1930s had 2.5 more times emergency room visits for asthma relative to the areas in the green. So again, what we're seeing with, like Dr. Wright was mentioning, this is, there's no longer explicit racism, but basically what ended up happening with structural racism is that explicit racism ended up being structured into our community and reflected in these different health outcomes.